Hi everyone, I am Dr. Karthikeyan, microsurgical andrologist and urologist at our hospital, Scripps Road, Chennai. In this video, I am going to take you through a patient whom we recently saw in the OPD and we had a success story. So here we had a 27-year-old husband and a 24-year-old wife coming with 3 years of married life and they were infertile. So when the wife was examined by the reproductive medicine consultant, she felt everything was fine and probably the husband could be having a problem. When we did the semen analysis, to everybody's surprise, we saw only 2 million sperms in the semen. So at this point, we then started going deep into the history. We asked them, are you trying to conceive every month and how long you have been doing that? And whether the husband is able to do a correct sex and ejaculate inside the woman's vagina. So these are two important things which we are supposed to tell here, because even though this couple is young, even though they are married for 3 years, they could not have tried. They would not have tried adequately. There could be an issue with the menstrual cycles. They may not know at what time they should attempt for conception. So all these things are usually checked. We will again see all these things in some other situation, but then in this particular patient, what did we do? So we took a detailed history as to whether his erections are adequate or his ejaculation is okay. And then we also asked him whether you are able to give the semen sample in the right way. Then everything was ticked. Then we thought that, yes, really there is a problem and we have to go ahead. So we did a clinical examination. The patient was actually not obese. He was thin patient and his testicular size was around reasonable size, around 12 to 15 cc, what we say. And is both the sperm passages were palpable. That means there is no block and there was no varicocele. So when we did all the tests, everything like the LH, the FSH, whatever we do, the hormone panel, which is displayed here, the LH report was around 2.5. The FSH report was around 3.2. The testosterone report was around 320. And the estradiol was around 35. So what does this mean? Here we see that in these reports, the only problem is in the testosterone level, where the testosterone is slightly low. Even though 320 is a normal value, that is more than 300, we thought that we should give him medicines and we also started him on injections. To our surprise, in the next 1.5 months, we started seeing the counts to be improving. Why were we surprised? We were surprised because this patient before coming to us had also consulted somebody else and they had not done a hormonal profile. They had just given medicines based on his previous semen report, which was showing around, say, 12 million. So the most important point, what I would like to stress as an andrologist, what I do here is I do a clinical examination. I do multiple semen analysis 2 or 3 times at least to see whether the report is reliable and is it correct. And number 3, we do what is called as a hormone test for the sperm, whether the sperm health is good or not. So as I told, the reports also, the LH, the FSH, the testosterone and the estradiol were most important tests to be done. And based on these reports, we can get a fair idea as to what is the problem. So once we started seeing improvement in the sperm parameters, the couple also, they got happy. They became more confident that there is some improvement. And then the couple wanted to ask us, since we are also young, our sperms are also good, can we try natural conception? Because the treatment suggested at that point was an intrauterine insemination. Then again, we also discussed with the couple, with the reproductive medicine consultant, whether we can allow the couple to try naturally. The decision was a yes, because both the partners are young and everything is okay, everything is favorable, and the sperm count have already reached a reasonable level where they can attempt for natural conception. This is all happening at around 1.5 to 2 months after treatment. Then what happened is we waited for another 3 months. So when they came to us, now it is almost 5 to 6 months. We then requested the couple to again do a semen analysis and it was almost normal. What we call as teratospermia is where only the morphology is less while the counts and the motility is very good. And the morphology was also 3%, which is just one number less than 4%. Then what we did is we discussed with the couple, why don't you consider 2 sessions of IUI consecutively? That is, in this cycle, 1 IUI and next cycle, 1 IUI, because this will give a fair chance or a better chance for you as you are young, as her eggs are okay, and as the sperm counts are improved well, why don't you consider IUI? So the couple also discussed and then they also came back to us. They were asking us, what is the success of IUI? Then the discussion came to that level where we were explaining them that IUI is a procedure which is not very greatly different from a natural conception trial, and what could be achieved by IUI might as well be achieved by a natural conception. So then we went on to explain that in one cycle for a normal husband and wife, where the sperm counts are okay and the eggs are almost okay. In this particular patient, the sperms were not okay, but now they are okay. So we can now take this couple as almost a normal couple, less than 30 years. That is very good. So we told them that per cycle, naturally, you have a 5% chance, but then with an IUI, you have up to a 15 to 20% chance. So they told that we will take the risk, we will go ahead with the procedure, because now that with the 3 years of problem, the family pressure is also building and we are on treatment. So we may not be able to continue the treatment for a long time. So what we thought is we are continuing the injections and the antioxidant medications, and we will attempt a cycle of IUI. So this IUI happened in the month of July, and now the couple is already 6 weeks pregnant. So what I would like to emphasize here, what I would like to tell here is IUI is a good procedure when the counts are good, when the counts have been made good, and when the sperm quality is otherwise good. IUI is a very good procedure. IUI is a much simpler procedure than a test tube baby. The points to be noted from this case. Why do we present this case? Why do I want to explain all these points here step by step is because when your count is low, it doesn't immediately mean that that is a problem. And immediately it doesn't mean that the treatment is only IVF, that is a test tube baby. If you are lucky, if you're able to find out, then we can always try these methods. Even though these methods are not always successful, it can be successful in the right patient. So that is the most important thing. Our aim is to identify, and our role is to pick up the right patient and give the right treatment. Here, the points why we force the couple to an IUI is because the patient is already taking injections and medicines for almost 3 to 4 months now, and nearing the 5th or 6th month, we may not be able to continue these injections for a longer time. And these medicines also usually have a time period of 3 to 6 months. So we gave the treatment, we gave the injections, the sperm counts improved, they attempted natural conception. But when the IUI is done, everything was successful. It was a happy ending. So finally, the points here are stepwise evaluation, identifying the right patient, the right treatment, and persevering with the doctor till the treatment is completed, because we don't know when the success will come. And if the success comes late, even then, better to wait, because it is like digging multiple. If you have to dig a borewell, if you dig at multiple places, maybe 15 or 20 feet, 20 feet like that in 4 places, you may not get water. But if you dig the same well 80 feet in the same place, then you are sure to get water. It is same way, sticking on to the treatment, continuing the treatment, perseverance, and confidence at the same time, reducing the stress. These are all the most important factors which will lead to success. And of course, treating at a young age, treating much earlier gives a better success than delaying the treatment. If you like the video, subscribe and share to your friends. Meet you in some other situation. Thank you.